Cloudcast Media. Drew Schlosberg Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
Welcome to Drew Schlosberg Spotlight on the Community, brought to you by Mission Fed Credit Union, part of the flagship show of Cloudcast Media. And you can tell by the voice that I am not Drew Schlosberg. He is actually at, should we say where he is, Kristen?
Yeah, he's at Jazz Fest. I think this is his 39th
Jazz
year.
Festival.
Yeah,
39th year. And so my name is Charles Parisi. I am the CEO and founder of Cloudcast Media. So I get a chance to jump in here today and have some fantastic conversations. And but those conversations are probably going to be led by Drew's longtime co-host, the one and only Kristen Vogel. Hey, Kristen, you and I haven't been on the mic in a while.
Yeah, we have not. We have not had a 45-minute podcast together in quite some time.
What do we call it again every morning when we're together?
We've named it Crispy Bacon for reasons I can't even remember anymore, but it's fine.
Crispy Bacon's not a bad way to start off what we're about to do here today, because we are going to be talking about food. In fact, you know what? I wrote down a quote. Would you mind if I read a quote?
Do I have a choice? No, please continue.
Because we're talking about food, and food is so powerful. So here's my quote from Guy Fieri, that's TV celebrity chef. Cooking is all about people. Food is maybe the only universal thing that really has the power to bring everyone together. No matter what culture, everywhere around the world, people eat together. So I'm really excited that we're going to be talking food today with Eva Matthews, the CEO of the one and only Mama's Kitchen. Eva, welcome to Spotlight.
Thank you so much for having me.
Hey, what do you, that Guy Fieri quote, what is, any comments, any feedback?
You know, this is really what I've been saying so frequently lately, because there is perhaps a lot of unsettled feelings around, and everyone likes to gather around food. Everyone agrees that it is so vitally important that we nourish the people who need to be nourished. And that is what we do at Mama's Kitchen.
Yeah, no question. Now, bring our listeners up to speed, because I know that Mama's Kitchen has been around for 35 years, started in 1990, and you've now been leading the ship for how long?
About a year and 4 months. So still early days, but yes, it feels like a wonderful year.
And you're the suit's feeling good on you? You're enjoying the ride, flying the airplane?
Absolutely.
That's
yes.
Great. What gets you up every morning?
What gets me up every morning is the community that we are serving and the volunteers and supporters who are there for us every day. They're really the heart of what we do. We have over 850 volunteers helping us to deliver over 900,000 medically tailored meals to people living with critical illnesses in San Diego every year. So they're vital.
That's unbelievable. Kristen, can you believe that 900,000 meals? You're probably realistically the busiest restaurant in all of San Diego. Probably up there.
Yeah. You know, we are the largest nonprofit provider of home delivered meals in San Diego. Our name belies that, but we really are reaching so many San Diegans all across the county.
And talk to us about the medically tailored aspect. And I'm also interested in this food as medicine kind of component that's rolled in with that.
Yeah. So, you know, I think about it this way. When you receive a diagnosis, you know, for a critical illness like cancer or chronic kidney disease or congestive heart failure, many of us would, when we get home from the hospital, we would kind of have the resources that we need. But many San Diegans don't have that. And so they may need very specific diets to support their diagnosis. And what Mama's Kitchen does is to take the mystery out of that. We provide those meals for our clients, excuse me, so that they can heal, they can recover from their illness and become well again without, without having to really struggle or be at risk of malnutrition because of their critical illness.
You know, Kristen, when I was doing my research to try to semi-prepare, so I would do
You're doing really well.
a decent job in to support Drew and his great show. Food is Medicine Coalition that you're you're truly pioneering. First on the West Coast to get that designation. Tell what exactly is that designation all about?
Yeah, so the Food is Medicine Coalition evaluated the services that we provided. So there's an accreditation process, and we went through about an 8-month review to ensure that all of our processes were up to standard, and our food and nutrition was up to standard. And what that does is, once we received our accreditation last year, it really communicates to the community and to our healthcare partners and our clients that we are a trusted resource for medically tailored meals. And until that accreditation existed, there was no standard set. And so this is a really interesting time in the food as medicine movement. Mama's Kitchen has been, on the forefront of that for the past 35 years, and we intend to be in that space moving forward as well.
So when you have, I guess, like chefs preparing meals and things like that, do they go out and seek that designation themselves? Are you teaching them how to do that? How does that whole process work?
So we are not actually providing accreditation to others. We provide the medically tailored meals to clients. And we have a chef who works in-house, and he collaborates with our 3 registered dietitians to make sure that our meals meet the requirements for a particular diagnosis. So for example, if someone has chronic kidney disease, what they eat if they have stage 3 kidney disease looks very different than if they are having dialysis. So as soon as someone progresses, we would make sure that they are moving to a different diet. So it's really important that our recipes are evaluated by those registered dietitians. And then the registered dietitians are meeting with our clients to give them nutrition education so that they can look at the nutrition labels, which are completely, filled with information.
Yeah.
And our registered dietitians can say, all right, pull out your favorite food from your cabinet. Let's take a look at, what makes that food perhaps not the best for your diagnosis or, okay for you to eat during this time.
Well, I'll tell you, Eva, as I'm listening to you talk about this, my mind always ends up going to behind the curtain and thinking about operations and logistics.
Yeah.
Can you give us just a little snapshot of how in the world do you get 800,000 meals out the door, customized for your patients? Give us a feel for what that is like on a daily basis.
It's a very complex process, but this team that we work with is so good at what they do. So, we have our chefs preparing the meals. We have an amazing, small but mighty kitchen team. And then we have our volunteers coming in. And so what happens is, as the recipes are plated and then bundled, we're having to choose which meals fit with which diagnosis, and they're bundled together. And each one is going to go into a bag with the appropriate snacks and additional pieces of the meal. And then all of that is bundled into bags. And when you're in the kitchen, it's really a sight to come in on a Thursday or a Monday and you see the entire kitchen surrounded with these bags. And they're then carted up and picked up by our drivers and brought all over San Diego.
Okay, well, back us up one more step, because that's amazing. I'd like to buy. I think I'd love to just come watch.
You should do
that all happen.
Yeah.
Let's go back a little further in terms of the sourcing of your food to prepare, to package, to deliver.
Yeah.
Where do you source your food?
So we have a few different suppliers of food. What we're trying to do over time is move toward getting as much locally produced food as possible. Some things we can't, but we're receiving food from San Diego, from California more broadly. We try to stay as local as we can.
And you do you get food donations? You have to pay for everything typically.
We are purchasing the food that we are producing, and that, because of the resources that we bring in, the revenue that we bring in, some of them have rules about donated food.
Mm-hmm.
So we typically do not use donated food, but we want to make sure we have the full chain of custody for all foods that we're using in our recipes. But
No, that makes perfect sense.
Yeah.
So, Kristen, I have a question for you.
Oh dear.
How many meals a week do you prepare?
Many?
How many? Give me a feel.
I don't know.
There's only 7 days in a week. You can figure this out, can't you?
like 2 out of each day. So
can you imagine? So you do 14 a week, let's say.
Yeah.
Can you
at
imagine
least.
800?
No, of course not.
I'm like,
no,
my
I
mind
can't
is
even.
blown.
I
can
have a
barely get
small
one
family.
meal.
Yeah, absolutely not.
It's incredible what you do.
It is. I'm wondering too. So you took a step back. I want to take a step forward, I guess, to the volunteers.
Let's do that.
Let's do that. Typically, how often do they work? Are your volunteers primarily delivering? Are there other ways in which they're helping to serve the organization? Can you speak to that?
Our volunteers are helping us in all areas of operations. Certainly, delivery is an area we always need.
Mm-hmm.
But really, volunteers are part of the kitchen team. They're part of our reception team. They are calling clients to help schedule appointments. They are helping us to package mailings. And, I really like to tell folks, whatever skill you have, whatever you would like to be doing, we can find a fit. So, we really appreciate volunteers in all areas of our organization.
Wow. A follow-up on that real quick. Or do you have many youth that are volunteering, let's say high school or middle school?
We have some. Some programs are easier for the younger crew, but those who are in high school and above, it's quite easy for them to fit into our volunteer operations.
So real quick, you're listening to Drew Schlosberg's Spotlight on the Community Show. We are here this morning with Eva Matthews, CEO of Mama's Kitchen, and we're going to maybe another question or so before we go to a quick break, and then we're going to leave the whole second half to talk about something really, really important, which is money and funding. Because what you do isn't free. It takes quite a bit of money, so we're going to talk about that. But got a question for you. Share with our listeners, who are you serving? Give us a feel for who you're serving.
We are serving a vulnerable population in San Diego. So those who may have fewer financial resources, we are serving individuals. More than 60% of our clients are older San Diegans, and we have 13% of our population are veterans. So many of them, even though we have no restriction in terms of income for clients that we serve, we tend to have about over 90% of our clients will be low or very low income. So we are serving folks who need us most.
I did see that, Kristen, when I did take a look at your annual report so I could even become more familiar with the amazing work of Mama's Kitchen. And I did notice, and Kristen, this is hard to, San Diego is so extraordinarily expensive.
Yeah.
But the average income, I think I noticed in your annual report, was $1,658 per month.
Yes.
Per month in San Diego.
Yeah.
That's who you're serving. So
I thought you were going to speak to this, 63% live alone thing that we were talking about also.
Well, that's it's funny you mentioned that. So to that point, I'm glad you mentioned that.
Yeah.
I saw one of your stats was that 63% of the humans you're serving live alone, which makes me think of there's this great quote in Italian, so I got to drop it in. Chi mangia solo si strozza. He who eats alone suffocates.
Mm.
Tell us about, do you have some volunteers who actually will sit down and have a meal?
Well, our volunteers need to go to many houses or homes in a delivery window, but we know that those connections that are made between clients and the volunteers or our staff drivers are so meaningful. I hear messages all the time. We receive cards. thanking them for their service. And, the first time that I delivered to a client, I was so happy to see, a new person wanted to talk all about the wonderful experiences he had had with Mama's Kitchen. And this is a connection that people really look forward to.
Wow. Yeah, that's great, because the company, I think alone, just seeing a friendly face, bringing food. Well, I'll tell you, but if there's ever an opportunity to sit down and have a meal with someone, I think I'd volunteer. Kristen, how about you?
Of course, yeah.
That'd be great. Are we going to do it together?
Sure.
Yeah, why not? Okay, so we're going to be back in a few minutes. You're listening to Drew Schlosberg, Spotlight on the Community, brought to you by Mission Fed Credit Union. Unbelievable community champion, pioneering so many important community activities in San Diego. We'll be right back in a second.
When you do your banking with Mission Fed, you get great rates on auto and home loans. That's good for you, but something good also happens for a lot of other people. We're not for profit, so we put money back into the community to help lots of great nonprofits to keep San Diego strong. So you're not just getting something good, you're doing something good. Come to Mission Fed. It's banking that's good for all.
Brand amplification is the DNA of Cloudcast Media, and our code is the powerful blending of sound, voice, and storytelling to lift local brands and their communities. Whether it is our Brandcast, Schoolcast, or Causecast platforms, the unifying ethos is all about this community, the one you call home. If you dare to dream and want to explore the brand amplification of Cloudcast, a national leader in local podcasting and other Winfluence strategies, please visit us at cloudcast.us. Welcome back to Drew Schlosberg's Spotlight on the Community Show. My name is Charles Parisi, filling in for Drew Schlosberg, who is at the New Orleans Jazz Festival, but fortunately, co-piloting the plane today is the longtime co-host of the show, Kristen Fogel from San Diego Writers, Inc. Hi, Kristen.
Hi.
We're back.
We are.
Okay. We have to talk money.
Yeah.
I'm overwhelmed that you do 800,000 meals per year. If my numbers are correct, it's about $8 per meal based on the budget I think I saw looking at your numbers. In that ballpark, I could be a little bit off, but
yeah, we're upwards of 900,000 this past year.
Okay.
And so in the coming year, we know that we're going to be serving many more. And so yes, this is not an inexpensive endeavor. We're providing breakfast, lunch, dinner, full daily nutrition, including healthy snacks for individuals living with cancer, diabetes, chronic kidney disease, and HIV. And we also care for their dependent children. So, and that is all provided free of charge.
It's unbelievable. When I think about, the quality food that you're delivering from A to Z, for such a small amount per meal, it's really amazing what you're doing. But I think we learned that about 40% or more than 40% of your funding comes from the federal government. Is that accurate?
That's right. So just under 30% is coming directly from our grants and contracts that originate with a federal funding source. And we're fortunate that we have a diversity of sources within that 30%. And then above that, we also are receiving reimbursement for some of our meals through Medi-Cal. And so for clients who do have Medi-Cal, that's, we're able to be reimbursed for some of those meals. So all of that is impacted by the current federal policy changes that are on the table. So we are definitely seeing a lot of instability, I would say, in decision-making around whether those funding sources will remain stable moving forward.
Yeah, we know there's definitely a storm in the country right now from a funding standpoint. So So you're hearing the winds and the howls, but has it affected your budget yet, or you're anticipating that it will?
We are definitely anticipating
Okay.
that it will. We're already seeing changes in the way that that funders are funding. So, for example, we're seeing even in the private funding sector, there's, for some funders, they're kind of delaying to see what's going to happen, and they can make decisions about how to focus funding moving forward. But the funding cuts that have already happened through the federal cuts, though even those that are not coming directly to Mama's Kitchen still have an effect on our clients. So whether or not whether it's coming from like the USDA funding cuts that will reduce funding for other food service programs, that diminishes access to basic nutrition. We will see if Medi-Cal in California is affected. People may lose their health care. That results in deferred care for themselves, and we may see them because they will progress in their diagnoses. It's really all of these impacts affect our clients in different ways. And if we do see that clients will need to produce, for example, evidence of employment to stay on Medi-Cal, our clients, most of them are homebound, as you read, and are quite ill. So even if they are eligible to be on Medi-Cal, they may not be able to handle all of the administrative burden that might come with new changes and new requirements.
Yeah. Well, listen, it's almost crazy that there's so many hoops and bureaucracy when we're just trying to feed people who need food, and that's really, really terribly unfortunate.
Yeah. And so besides pulling your hair out every day, what are you doing to, kind of get ahead of this? I can't imagine.
Yeah. So right now, I like to tell folks, we're not panicking.
Mm-hmm.
I don't think it's productive to be in that mode.
Yeah.
But what we are doing is we're scenario planning. We're making sure that we're looking at multiple different ways that we might be able to move forward. If we were to lose federal funding, we're talking about, over 375,000 meals to over 1,200 individuals that would be affected. That's really meaningful. So we're really trying to figure out how we can make some redesign internally, but really look at where the funding can come from if it's not coming from these sources.
Yeah, and even if you figure out a way to operationally trim things a little bit here and there, whether it's packaging, sourcing, and the final analysis, you need to probably bring in more money from the community.
Absolutely.
There's only so much you can cost cut your way to prosperity, as they say.
That's right.
So the question is, what is the plan to energize the community to step up and say, hey, there's a storm, give us a little financial umbrella?
Yeah, I love the way you put that, the storm. We want to get above the noise. We want to get above these clouds. So, what we will be doing is launching a resiliency fund. Our goal is to raise $1 million that will allow us to not just stabilize what's happening right now, but continue to be the innovative leaders in San Diego in this food as medicine space, to make sure that every San Diegan who needs our services will have our services. And so we're really excited to get that going. We have a lot of folks who are excited to jump in with us. So we're happy about that.
Well, listen, I love it. In fact, I'm gonna put this out there because we have two of our young, we've got our associate producer here and we have one of our production engineers in studio. And I know they're young, they're in college age, and they like to eat out all the time. So I'm going to encourage each of them this week to not go to Chipotle, not go to some of your favorite restaurants. Save that money, and I want you to send it to Mama's Kitchen. So I'm going to nudge them when we're leaving studio here, and I'm going to buy a few meals this week myself to do what I can, because I think the whole community's got to kick in. These are our brothers and sisters that you're taking care of. I also noticed that 12% of the folks you serve are veterans.
Yes.
How is this possible?
Well,
in America?
Exactly. I'm so pleased to be able to work with our veterans and to work with our local VA health, in terms of receiving referrals and making sure that veterans have access to our services. That's really going to be something that we have to spend, some more time, more energy around ensuring that all of our veterans in San Diego who need our services have them. It is not currently a covered service for veterans unless they are receiving Medi-Cal. So that is something that I would love to see change.
That's really frustrating, Kristen.
Yeah.
Well, listen, no one should be hungry, but if you were willing to put your life on the line to serve in our military, there shouldn't be this issue.
No brainer. Yeah.
Should be a no-brainer. Department of Defense with all their funding, deserved. I think the money should be there to help our veterans. Tell us about Mama's Day.
Yes, Mama's Day is coming up. We're so excited. It's June 6th this year, and we will be again at the Hilton San Diego Bayfront, and we have an early VIP session from 5:30 to 6:30, and then general admission starts at 6:30. And we'll have culinarians from all over San Diego providing samples of their delicious food, and we'll have live music and entertainment, and it'll be a great evening.
Mm-hmm. Kristen, are you performing?
No, I have not been asked to perform as of yet.
Because she does a great song and dance routine.
Oh, thank you for that. So does Charles.
Yeah, exactly.
Yeah.
Opera, of course.
Right, of course.
You have an opera stage or no?
Oh, I wish. Yes, we should have an opera stage if you can come and sing opera for us.
Hey, you know what? You mentioned earlier about there was 2 days in the week you mentioned it's a cool day to be there, see what happens. What were those 2 days again?
Oh, yeah.
Yes, Mondays and Thursdays are the day before our deliveries. So we deliver every Tuesday and every Friday to over 800 households. And so it's quite a sight. And so when sometimes we have folks come and visit and take a tour and learn more about us, and those are great days to visit.
How many delivery trucks do you have on the road?
So that's a great question. We have 4 vehicles that are in our fleet, but we also have all of those volunteers who are coming and they're driving their own vehicles to take those meals to each of the clients on their route.
I think one of our young production engineers who's also going to skip Chipotle and fund you this week, I think he might have to volunteer to deliver some meals. So what do you need to be a volunteer driver besides a clean driver's license?
Yeah. So what we do is we have folks go to mamaskitchen.org. You click on that volunteer or that volunteer button and sign up. We have a form that you fill out. It's really simple, and we'll get you to an orientation and then off on the road or up into the office if folks, or in the kitchen if they want to participate in other ways.
Do you have volunteers that have been kind of participating from the very beginning, or some of these longer term volunteers?
We do.
Yeah.
Oh my goodness. We have folks who've been with us for I think upwards of 29 years.
That's so cool.
And they have their children and their children's children with them. So we have multiple generations. We have couples who have met
really
for volunteering, who have married and had children, and now take those kids on delivery routes. It's an inspiring space to be.
Okay, Kristen, I think we know what to do here, don't we?
Start marrying people, volunteers that meet through Mama's Kitchen? No, guide me.
Great idea. Great idea, but not the answer I was thinking
great.
of.
Okay.
So I think what we need to do, Eva, is have you come back and bring one of those married couples with you.
Oh,
my goodness.
Could you arrange that?
I'll see if I can do that. Yeah, that would be fun.
Or if not, then maybe one of your 29-year volunteers.
Yeah.
Wonderful. To have that. What do you think, Kristen?
I think that sounds great.
Yeah, but Drew will probably be back, so I won't get to.
But if we can marry anyone for you, just let us know.
Okay.
Yeah.
Yeah, we can do a little.
We'll get ordained.
They get married right in the show.
Yeah.
That'd be spotlight. Well, listen, Kristen, any final thoughts or for
No,
Eva?
just thank you for the good work you're doing, and I really hope that this is like a small piece to get people to drive donations or volunteers or things like that, because you do such an amazing service for the community. So thank you.
Thank you. I appreciate the time today.
Yeah.
Well, listen, listeners, I hope you really enjoyed this particular episode of Drew Schlosberg's Spotlight on the Community, part of Cloudcast Media, brought to you by Mission Fed Credit Union, doing amazing things for San Diego for over 60 years. If you know the Mission Fed name, you know they're everywhere in the community, helping every possible way that they can. We've been here today with Eva Matthews, CEO of Mama's Kitchen, incredible organization, 35 years in running, over 900,000 meals a year, 12 million meals in total since they started. The first on the West Coast with the Food is Medicine Coalition. Thank you for listening, and do your part and help them out.
You've been listening to an episode of Drew Schlosberg's Spotlight on the Community show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego community. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
Cloudcast Media.